Question number 1. The first stage of labor is characterized by A. Cervical dilation. Right answer. Second number question. The second stage of labor begins with right answer B. Complete cervical dilation. Question number 3. The normal duration of the first stage of labor in a primigravida. Right answer C. 10 to 12 hours. Question number 4. Which hormone is responsible for uterine contraction during labor? C. Oxytocin. Question number 5. The term station in labor referred to. Right answer B. Question number 6. The most common presentation during labor is. Question number answer 6. Vertex. Question number 7. Engagement occur when. Right answer C. The fetus descend to station. Question number 8. The cardinal movement of labor include all except. For more video, please subscribe my channel. D. Placental expulsion. Right answer. Question number 9. Episiotomy is performed to. Right answer B. Facilitate delivery of the head. Question number 10. The most common type of episiotomy is. अगर आप नए हो तो चैनल को सब्सक्राइब कर लें जिससे कि हमारी ऐसी वीडियो आपको मिलती रहे. B. Mediolateral. Question number 11. The third stage of labor involve. थर्ड स्टेज ऑफ लेबर में लेबर के थर्ड स्टेज में क्या इन्वॉल्व होता है? डिलीवरी ऑफ द प्लेसेंटा. क्वेश्चन नंबर 12. एक्टिव मैनेजमेंट ऑफ द थर्ड स्टेज ऑफ लेबर इंक्लूड. Right answer is D. All of the above. Question number 13. The normal duration of the third stage of labor is. B. Right answer 10 to 20 minutes. 14 number question. Fetal heart rate during labor is normally fetal heart rate during labor. Right answer D. 160 to 180 beat per minute. 15 number. True labor pain are characterized by. ट्रू लेबर पेन का कैरेक्टर क्या होता है इसमें से? सी. राइट आंसर सर्वाइकल डायलेशन एंड इफासमेंट. क्वेश्चन नंबर 16. द बाइशॉप स्कोर इज यूज्ड टू असेस. बाइशॉप स्कोर is used to assess A. Cervical favorability for induction of labor. 17. The most common complication during the second stage of labor is. Most common complication during the second stage of labor. Right answer B. Shoulder dystocia. 18 number. Rupture of membrane is diagnosed by. A. Night gene test. 19. Prolonged labor is defined as labor lasting more than. D. 24 hours. 20. Fetal bradycardia during labor is defined as a heart rate below. 100 beat per minute. 21 number, amniotic fluid is assessed using A. amniotic fluid index AFI से amniotic fluid हम assess करते हैं. 22 the most common cause of postpartum hemorrhage. मोस्ट कॉमन कॉज क्या है पोस्टपार्टम हेमरेज का? यूटेराइन एटोनी, यूटेराइन का टाइट हो जाना, कड़क हो जाना. 23 ए पार्टोग्राम इज यूज टू मॉनिटर, पार्टोग्राम का हम मॉनिटर का यूज करते हैं तो प्रोग्रेशन ऑफ लेबर के प्रोग्रेस को देखने के लिए. 24 द पेल्विस मोस्ट फेवरेबल फॉर वेजाइनल डिलीवरी इज बी. राइट आंसर gynecoid pelvis. 25 a transverse fetal lie is most common in, transverse fetal lie is most common in कौन सी ग्रेविडा में होता है? मल्टीपल प्रेगनेंसीज में होता है. 26 द MC Robert maneuver is used to manage. Right answer C. shoulder dystocia. 27 an indication for cesarean section includes.
Answer is option D, all of the above.
D. right answer, all of the above. 27
28 the latent
28 the latent phase of labor ends at.
Right answer is option A, 3 centimeter dilation.
A. right answer. 29 uterine rupture is most commonly associated with.
Right answer is option A, previous cesarean
right answer A,
section.
previous cesarean section.
Question number 30.
Crowning occur
occurs
when? Last question is, अगर आपको वीडियो अच्छी लगे हो तो चैनल को सब्सक्राइब जरूर करिए.
ऑप्शन
A. right answer, the head is visible at the vulva without retraction.